Warahmatullahi wabarakatuh dan selamat pagi. Selamat datang ke webinar Pita UiTM Cawangan Sarawak SIRI ketiga bagi tahun 2021. Saya Dr. Kamaluddin Jarai selaku moderator anda pada webinar pada pagi ini dengan sukacitanya mengalu-alukan kehadiran tuan-tuan dan puan-puan yang telah menyertai SIRI webinar kita pada pagi ini. Webinar SIRI webinar kita pada pagi ini sangat penting juga saya rasa kerana ianya membicarakan tentang isu-isu semasa berkaitan dengan masalah pandemik COVID-19 yang kita alami sekarang ini. Okey, baiklah. Sebelum itu saya ingin memperkenalkan penceramah ataupun panelis jemputan kita pada pagi ini. Beliau merupakan seorang pakar perubatan keluarga dari Klinik Kesihatan Asajaya Kota Semerahan. Beliau telah bertugas di klinik tersebut lebih kurang dalam 10 bulan dan nama beliau adalah Dr. Sarah Chew Ching Jen. Hai Dr. Sarah.
Hai.
Okey. Siri webinar kita pada pagi ini sangat istimewa kerana buat pertama kalinya kita tidak akan menggunakan slide untuk as we go through dan juga siri webinar kita pada pagi ini akan dikelolakan dalam dua bahasa, bahasa Malaysia dan juga bahasa Inggeris. Jadi disebabkan masa semakin pendek, jadi saya tidak mahu melengahkan masa dan kita akan sesi kita pada pagi ini lebih kepada kita berbincang dan juga mencari jalan untuk merungkai sebarang permasalahan yang tuan-tuan dan puan-puan rasa perlu diatasi. Jadi tanpa membuang masa, kita akan menjemput Dr. Sarah untuk memberi sedikit kata-kata aluan dan juga seterusnya mengendalikan sesi webinar kita pagi ini ya, Dr. Sarah. Ataupun Doktor selepas memperkenalkan sedikit, nanti saya akan bertanya tentang soalan yang telah ditanya oleh warga netizen sebelum ini. Boleh Doktor?
Okey, boleh.
Alright, kita silakan Doktor.
Okey, so selamat pagi semua. So sekarang pandemik COVID-19 tengah berlaku untuk tahun kedua. So mula-mula awal tahun ini kita sudah memulakan program vaksinasi COVID-19 di negara kita. So fasa pertama sudah tengah berlaku dan fasa kedua akan mula berlaku dalam minggu ini. So setakat ini negara kita ada menggunakan dua jenis vaksin yang telah diluluskan oleh NPRA Malaysia. So dua vaksin itu adalah vaksin Pfizer dengan vaksin Sinovac. Okay, so vaksin Pfizer adalah satu jenis vaksin yang macam high tech sikit. So dia dikenali sebagai mRNA vaksin. Dan Sinovac vaksin adalah satu vaksin yang tradisional yang kita panggil nama lain dia adalah inactivated vaksin. Maksudnya dia dah virus itu sudah dimatikan. Okay, so dua-dua vaksin ini dibagi secara suntikan di dalam otot kita di atas lengan bahu kita. Okay, dan dua-dua vaksin ini pun memerlukan dua dos. Dua dos 3 minggu, tempoh selang 3 minggu untuk dos yang kedua. So dua-dua pun mengalami kesan sampingan yang hampir sama dan dua-dua pun adalah sangat efektif dalam melindungi kita daripada mendapat dari COVID-19 jangkitan. Okay.
Doktor, why we should take vaccine in the first place?
Well, I take the vaccine to protect myself and also to protect the people around me and the community as well. So when I vaccinate myself, I prevent myself from getting the infection and indirectly I'm also preventing myself from transmitting the infection to the people surrounding me. So if everybody has the same thinking and same responsibility, then many of us will do the same and then eventually we'll get something as we call as herd immunity, or another nicer word could be community immunity. So the whole community has got immunity towards the COVID-19 virus.
So kita jaga kita lah, doktor.
Ya betul.
Hashtag
Ya
kita
betul.
jaga kita. Alright, thank you,
Ya
doktor.
betul.
Okay, saya ada pertanyaan juga ni, doktor.
Ya.
So kita tahu tentang kepentingan kita mengambil vaksin adalah untuk melindungi diri kita. Komuniti juga mengambil vaksin untuk melindungi diri mereka, dan lambat laun kita akan jaga diri kita semua, kan? Betul, doktor?
Betul.
So lately, doktor, kita sebagai masyarakat milenium ini dan terdedah kepada banyak informasi melalui media sosial, we have seen and heard a lot of comments regarding those who are against the vaccine and those who previously support the vaccine, but lately become flip-flop in their statement, and then together with the news about some side effect, adverse side effect and so on. Apa komen doktor tentang perkara ini?
Okay, so agak sensasi lah berita kesan sampingan vaksin ini yang tengah berlaku setelah kita start dengan vaksinasi program di negara kita. Ada yang banyak I don't know what to say, mitos, there are a lot of comments and maybe baseless. It's quite baseless actually, but I will try my best to unravel or to explain any uncertainty regarding the side effect. So when we talk about side effect, basically all medical things have side effects. Okay, something as simple as even taking a Panadol can get you side effects. Something as simple as a painkiller can get you severe side effect. In fact, painkiller can cause you to have something like kidney problems, heart attack, or even have a severe drug reaction, severe allergy. Okay, so going back to the vaccine, so side effect for vaccine is usually very, very mild and very temporary. So dia sangat ringan dan sementara sahaja. So biasanya the side effect adalah commonly is the sakit di tempat suntikan itu bengkak, merah, demam, rasa menggigil, sakit kepala. I think these are very common side effects. So these side effects, they happen for a while, maybe 1 or 2 days, and then it'll go away on its own. Kebanyakan masa tidak perlu nak makan ubat pun, dia akan hilang sendiri. So yeah, so these are the common side effects. So then people are talking about, I think recently there is this big hoo-ha regarding blood clots in relation to the AstraZeneca vaccine, and then the netizens are like asking the government not to take the AstraZeneca as was promised earlier on, because as we know this COVID vaccine, the government is buying from different companies to cater so that we can vaccinate the whole community, the whole nation in a shorter period of time. Okay, so one of it is Pfizer, Sinovac, Sputnik, CanSino Bio, and the other one is wait, hold on, let me just check. And AstraZeneca as well. So AstraZeneca is being said that 20% of the population of Malaysians will get AstraZeneca. So this blood clot, it is actually a very, 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 very rare event. Very rare. So many varies that I use, it means it's very, very rare. So the incidence of this event, this very unfortunate blood clot events are actually happening 4 in 1 million only. So 4 in a million can be translated into something like 0.0004%. But if you get a COVID-19 infection, the COVID-19 infection causes a very high incidence or high risk of getting blood clots. And the incidence is as high as 16 or 17%. So to get to get COVID is very possible, right? So I think to get this side effect is there. I'm not saying it's not there, but it is very 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 rare. In fact, getting a side effect from a painkiller is more common than this side effect of this blood clot. So I'm trying to just trying to paint a picture of how uncommon it is. Yeah, how uncommon it is. So yeah.
Because the vaccine is still new, so everybody is very eager and very agitated, Doctor. I think that's why a lot of things are rising from this eagerness and anxiety actually. By the way, Doctor, can you differentiate between what is side effect, what is complication? Because some of the netizen might do not know, because all of them, those who have changes after receiving vaccine is considered dangerous. Is it true?
Okay, so we need to know why we experience some side effects lah. Okay, side effects. So something like pain and swelling, fever, these are all reaction of your body towards the vaccine. So this is a process where your body, your immune system in your body is actually building the antibodies. So in the process of building the antibodies, your body will undergo some kind of reaction. So this is what we call reactogenicity. So which means that the body is reacting to the vaccine, and the vaccine is being working. So you're building an antibody in your body towards the COVID-19 virus, but at the same time you may have some kind of side effect to that production of the antibody. So I would not call the side effect, the common side effect, as complications of the vaccine. In fact, the complications that people talk about, I don't think it's an actual event. It's just that the side effects that we report it's not known as complication. It's just known as a side effect of the vaccine. So I mean, people all know, like, we go back to the painkiller again because it's so common, right? People just pop painkiller like nobody's business, correct? If they got a headache, they just get a painkiller. If they have a knee pain, they get painkiller. They have a muscle pain, they get a painkiller. So they pop the painkillers without thinking that actually there's a lot of risk involved in eating the painkiller. So this is the same. It's somewhat the same thing because it's quite new. This vaccine is new, so people are very very wary or very scared of new things, changes and new things. But we need to look at the science and the data. Then only we can make a decision on ourselves. So going back, this vaccination is not compulsory. The government did not make it compulsory. It is voluntary. So if you don't feel comfortable, it is your choice. But we only can help you to make an informed decision, that whatever information that we give you, help you to make the best decision for yourself and your family as well. Yeah.
Okay. Talking about the side effect, reaction, and the complication, do you know any group of people that might not be suited for vaccination, like those who are grouped to be careful and so on? Do you have the list that mungkin para pendengar kita ataupun para penonton ingin tahu, do I should get or should I be reserved first?
Okay.
Do you have anything to say?
Yeah, so setiap orang yang ambil vaksin, ada pegawai yang akan menentukan this pesakit atau kandidat dia layak ke tidak untuk dapat vaksin ini. So ada beberapa kriteria yang menentukan kandidat itu dia layak atau tidak. So kebanyakan orang memang layak, okay. So and then orang akan cakap, what about if I got allergy? If I have a seafood allergy, if I have an allergy towards antibiotic, for example, or I have an allergy towards painkiller, for example. So basically, most people have some form of allergy, I must say. Actually, some kind of, especially seafood or commonly antibiotics or painkillers. So these kind of people, they can take the vaccine. they can take the vaccine. Okay, so as long as their allergy reaction is not severe, which means that alahan yang teruk, maksudnya perlu nak masuk hospital disebabkan oleh alahan itu. So kalau dia tidak perlu nak pergi sampai hospital, dia boleh nak dapat vaksin itu. Okay, then there are some people that actually have we give the first dose and then they develop some kind of reaction. For example, they got rashes, general body rashes, kemerahan, ruam-ruam ke. Those kind of people may not be suitable for second dose, which means that they have some form of allergy reaction towards the vaccine. However, having said that, it's very very rare lah to get allergy towards vaccine per se. Yeah. Even if you have allergy towards previous vaccines, like any kind of other vaccine, they can still take the vaccine. However, we may want to recommend them to take in a more controlled environment, such as in a hospital setting or under a place where they have a more controlled environment. Maksudnya ada pakar-pakar yang lebih yang boleh standby untuk if any event were to happen lah. That's all. Yeah.
Okay, alright, doctor. So we know that those who are eligible, those who are been put under special attention, how do we register, doctor? Do we can walk into the klinik kesihatan and tell the staff I want to get vaccinated?
Okay, so pendaftaran vaksin as diwawarkan on the net, on social media and many places, there are many ways that you can register yourself. Satu cara adalah guna the My Sejahtera app, okay? Tapi saya faham, understand that in Sarawak especially, the internet connectivity is not that great. So kebanyakan orang mungkin tidak ada telefon pintar atau maybe they don't know how to download the My Sejahtera app. So those kind of people, they can give their names to the ketua kampung that can give the names to the pejabat daerah. Okay, so the pejabat daerah then in turn will give the names to the KKM. And then the pusat pemberian vaksin akan diberikan senarai nama lah orang yang telah didaftar mengikut cara ini. Cara yang ketiga, you can go to the laman web JKVAV, that you can go and daftar yourself on the laman web itself lah. Okay, and then there is a hotline that you can call. I can't recall offhand now what is the number of the hotline, but there is a hotline yang boleh nak panggil untuk daftarkan diri juga. Satu lagi cara, the fifth way is to pergi ke klinik kesihatan untuk pergi daftar diri. Not as in kamu maksudnya bukan kamu walk into klinik immediately you daftar immediately dapat the vaksin, tidaklah. Untuk daftar walk into klinik tu daftar diri untuk vaksin boleh.
Alright, so kita tahu daripada penerangan doktor, cara untuk mendaftar adalah menggunakan aplikasi My Sejahtera. Kalau di Sarawak mungkin disebabkan masalah konektiviti, keluarga kita yang ada di kampung dan sebagainya boleh menghantar nama kepada ketua kampung ataupun pejabat daerah masing-masing, doktor. Selain daripada laman web JKPAV dan juga hotline dan juga pergi terus ke klinik kesihatan yang berdekatan. Doktor, do you have any data concerning percentage of those who are already registered for voluntary vaccination in Sarawak?
I think I just checked yesterday. I think in Sarawak, the 40% of the population has already registered for the vaccine. So we are quite okay in terms of the other states, right? So we are catching up lah. Although we're a very big state, we're the biggest state, but I think 40%, that's almost half of the population that we aim to vaccinate, which is a good sign lah. So I think people are more open and more perceptive to getting the vaccine, which is very good.
Doktor, boleh saya bertanya lanjut tentang do you have any idea like what is the target for JKNS, Jabatan Kesihatan Negeri Sarawak, for the population of Sarawak particularly to get vaccinated? Okay. Do they have a timeline or any targeted months ke, masa ke dan sebagainya?
Okay, so in Sarawak, we aim to vaccinate 80% of the population, including non-Sarawakians, including foreigners as well. So everybody will get the vaccine for free, and we aim to vaccinate 80% of the population in Sarawak by end of August.
And August this year.
Yes, that's right.
Wah, sekarang sudah bulan 4 dengan bulan 4. So the current percentage of those residing in Sarawak get vaccinated, do you have the numbers of that?
I do not have the numbers offhand right now, but I do believe that this can be achieved because the state government has been given the green light by the federal government to self-purchase their vaccines. So the state government has pledged that they will purchase vaccines for their people so that they can achieve the target of vaccinating the 80% of population by August. Yeah.
Yeah. Doctor, just now you said currently in Malaysia, the government is using Pfizer, Sinovac,
That's right.
and coming short will be on AstraZeneca. This
Yeah.
might be a sensitive issue because a lot of netizens would like to know the effectiveness and the safety issue about this vaccine. Can you comment on that, Doctor?
Okay, so we'll go with Pfizer first. Okay, so Pfizer is the first vaccine that was mandated and approved under WHO, under emergency under authorization use. So this vaccine is about 95% efficacious. So maksudnya keberkesanan vaksin ini adalah 95% in the clinical trials result. Then the Sinovac vaccine is about 50 to 80% keberkesanan dia, depending on because why is there a range? Because the different efficacy was found in different population for Sinovac. Okay, so then the AstraZeneca as well has got a good efficacy of about 60 to 80%, 80+%. So these three vaccines are three different vaccines. They have the same goal, but they are different types of vaccine. So the first vaccine, Pfizer, is the mRNA vaccine. And the second vaccine, Sinovac, is the inactivated vaccine. And the third vaccine, the AstraZeneca, is a viral vector vaccine. So they all work very differently, but they all have the same response, which is to have an antibody production against the COVID-19 virus. Just the way they work is differently as well. Yeah.
Okay, this might be require scientific explanation, Doctor, although our viewers might not in a medical line. Can you please, in a very simplest way, can you, just for our knowledge lah, we in medical know about this lah, but for our viewers, maybe they might wanted to know what is mRNA, what is vector vaccine, what is inactivated vaccine. Can you have any simplest?
I will try my best. Okay, mRNA vaccine is basically a very high-tech vaccine. Okay, so what we mean by high-tech is that there is no content of the actual virus in the vaccine. Okay, so they package the vaccine. Okay, it is in a very clever packet. There is clever packet so that the packet will not be destroyed by the body when it enters the body. So it is able to go into our cells, into the cytoplasm, and it will release a code. It is like a set of instructions. It's like a set of instructions for your cells to produce the spike protein on the cell. So that's how it works. So by the time they actually build the spike protein, the mRNA inside your cytoplasm, which is not in the nucleus, cytoplasm, it will be degraded by your own body itself. So it will basically disappear inside your body, but your body already have got the instruction to make the spike protein. So then your own antibodies, your own ASCA will then recognize the spike protein as foreign, as bukan your own one. So they will make antibodies towards that foreign object, which is the spike protein. Okay. So that is the mRNA vaccine. So the inactivated vaccine is basically the COVID-19 virus, but it has been so-called inactivated because it's already very weakened. It is weakened, very weakened vaccine. Yeah. But it does not cause any infection in your body. So when they inject this weakened virus into your body, then your own ASCA will identify this weakened virus and they will generate an antibody towards this weakened virus, and then you have an antibody towards COVID-19 virus. So that is how inactivated virus works. It's a very traditional vaccine. A lot of our vaccines use this way, like our childhood immunization program. Yeah. So the DTaP, like a tetanus vaccine, influenza vaccine, they all happen in this way. So viral vector, AstraZeneca is a viral vector. So viral vector, this AstraZeneca, they use this virus called adenovirus. Okay, this adenovirus is basically like a flu virus. It is like a flu virus. They take a flu virus and then they weaken the virus to carry a set of instruction. It is similar to the mRNA, except the mRNA use a different parcel. This one use a virus to carry the set of information into your cell. Then it will instruct your cell to make the spike protein, and then the body will then build the antibody towards the spike protein, and then you have antibody. So that is as simple as I can explain.
All right. That will actually answer a lot of question concerning the type of vaccine that currently being used in Malaysia, Doctor. All right, thank you very much, Doctor. In certain group of people, they keep on saying that this is the West agenda towards domination of population. Do you have any idea about this, Doctor, in terms of halal haram or whatsoever? Do you have any idea on this? Does our vaccine being used here, is it halal to convince the Muslim community?
Okay, I will do my best. All right. Okay, so there is a special meeting that was held by the Jawatan Kuasa Muzakara Majlis Kebangsaan bagi Hak Ehwal Agama Islam. Okay, they had come up with the fatwa that the hukum is for this vaccine is harus and wajib for certain groups of people. So these certain groups of people, they mentioned that it's for the government to decide lah. Okay, but basically, usually it's those high risk groups that would really need this vaccine, because the high risk groups, which are the orang tua, orang yang ada masalah kesihatan such as kencing manis, darah tinggi, boleh perlu wajib untuk ambil this vaccine lah. So in terms of the fatwa, it is harus and wajib in certain groups. But whether it is the issue of halal and haram, okay, so this vaccine has got no sumber haiwan inside this vaccine. So there's no like porcine base. It's not. There's no. So there's no sumber of khinzir inside this vaccine. Okay. Also, this vaccine does not cause any kemudaratan. So in other words, this vaccine has been said to be halal as well. So it is halal and harus to ambil this vaccine.
Okey, terima kasih Doktor. So penjelasan Doktor itu sungguh mantap sekali untuk meyakinkan especially the Muslim community, Doktor, those who are not yet been told about the halal and haram about this vaccine lah. Alright, so doctor, there is a concern among the netizens also. Is everybody eligible to take the vaccine, or is there any age requirement, doctor, that can be, the age requirement that can fit the vaccination program in Malaysia?
Okay, so at this point of time, the vaccination is only for people that umur 18 tahun dan ke atas. For now, it is 18 tahun ke atas. But as we are speaking, there are trials that are going on for children, for 12 to 18 years, for the Pfizer vaccine, on the keberkesanan of the vaccine on children. So, but the result has not been published yet. So we're waiting for that result. For at the time being, anybody between 18 and above lah. So it doesn't matter if you're 80 years old, if you're 90 years old. So there's no time limit or the age limit for you to get the vaccine. Okay. Then in terms of medical problem, most people with medical problem are able to get the vaccine, but some small group of people where their immune system is compromised, maksudnya dia tidak sistem imun dia tidak kuat sangat. For example, cancer patient on chemotherapy, HIV patients that the antibody level is very low. For patients with taking medication that can, as we know, can suppress their immune system. So this kind of patient we still can give, but we need to make sure the timing of the vaccine is the proper time. So we have to discuss back again with the specialist that is involved in the treatment for this patient on which time is the best time to vaccinate them. Because because as you know, all disease got its ups and downs, right? So when the disease is more controlled, then we can give the vaccine during that time. But basically, it can be given to most people, yeah.
Ya, maksudnya adalah parameter-parameter yang akan diambil kira oleh doktor-doktor pakar sebelum membenarkan sama ada seseorang itu boleh atau tidak mengambil vaksin, kan doktor? So adalah lebih baik bagi semua untuk mengetahui bahawa discuss it with your own doctor, so the doctor might know very very well about your condition. Don't just simply ask in social media lah. Social media ramai doktor yang tidak berdaftar dan bertauliah, ya. So tuan-tuan dan puan-puan, jika ada keluarga atau diri yang ada sebarang masalah perubatan dan kesihatan, silalah berbincang dengan doktor yang merawat kerana mereka mengetahui apakah petunjuk-petunjuk yang akan diambil kira sebelum membenarkan atau menangguh dulu pemberian vaksin kepada pesakit. Okay. Alright. So doktor, kita masih ada masa untuk kita bersoal jawab dalam sesi webinar siri ketiga Pita UiTM Sarawak ini. So tadi kita juga ada menerima banyak pertanyaan-pertanyaan daripada netizen tentang of course most of it due to the safety, efficacy and reason lah. I think most of it have been answered by you. There's one here question, doctor. Dia kata, why must I get 2 doses of vaccine? Why not one? Mengapa mesti dua, doctor?
That's a good question. So it is found that after the first dose, the efficacy of the vaccine is only about 50%. Okay, so we are talking about Pfizer lah, this one. So if first dose of 1 dose of Pfizer vaccine will give you an antibody immunity of 50%. But 2 doses of the vaccine will give you a antibody immunity of 95%. So that we try to give as much protection as we can get. So that is why it is recommended as 2 doses. Is to boost your immune system. For the second dose is merely to boost your immune system for the antibody production. But having said that, ada je yang vaksin yang single dose vaksin. So satu is the CanSino vaccine, and satu lagi which we are not getting is the Johnson and Johnson vaccine. Dua-dua vaksin ini is single dose vaccine, and it is about 80 to 85% efficacious. So I think CanSino, especially the single dose vaccine, is very suitable for Sarawak. Actually, I feel, because it's when you have to go to the interiors of the Sarawak, it's very difficult to go for the second time to give them another round of vaccination. So yeah, that would be. But then again, we leave it to the policymaker to decide on that. Yeah.
Yeah, all right. Okay,
But,
Doctor. Yeah, do you have anything to say?
Yeah, and I think recently, within this week or last week, the CEO of the Pfizer company had made a quite quite a statement lah. He mentioned something like that we may need a third dose, and then thereafter we may need an annual dose as well. So all that actually, the company itself cannot decide whether we should get the third dose and annually after that. It's actually more of our government decision as a whole to decide whether should we actually take a third dose, and we need to see data. Why should we take a third dose and so forth? So at this point of time, whether we need a third dose or not, I think no. But we have to see again as data comes in, how long the immunity lasts for. That also we have not much of data. So as now as we know that the immunity actually is effective for 6 months, a year. But as we know, because as you know, COVID is very new, so and vaccination is even newer. So we're still learning as we go along in terms of its how long the protection will be, and how much do we need, and do we need a third dose and so forth lah. Yeah.
Yeah, very good explanation, Doctor, because everything is new here. The virus is new, the vaccine is newer and so forth.
Yeah.
So memang untuk makluman warga netizen dan juga para pendengar sekalian, situasi yang kita alami sekarang ni memang adalah situasi yang sangat-sangat baru, dan kita di dalam fasa mencuba yang terbaik untuk supaya memberi kesan yang baik kepada semua masyarakat dan juga rakyat sebenarnya. Okay, setelah kita tahu, as we know who are eligible, who are not, and then how to get registered, then we know a bit about the foundation or basic thing about the virus, type of vaccine, macam mRNA, inactivated vaccine dan juga viral vector vaccine dan sebagainya. So maybe doktor boleh terangkan sedikit tentang jika sekiranya saya telah divaksin, do I still have to wear the mask and follow SOP?
Okay, good question. Alright. So a lot of people bila sudah divaksin, dia akan rasa a sense of security. Okay, they akan rasa that they have been protected against this virus. But we also need to know that to be fully vaccinated, it means that it is 2 weeks after your second dose, then you are considered as you have completed your vaccination. So so that's why that, you know, the recent news that there were 40 frontliners that were vaccinated, and they had actually gotten the COVID infection. So there was a lot of sensation regarding that as well. But we need to see the very big picture. The bigger picture is that it was found that a number of them, more than half of them, were actually infection gotten after the first dose. They did not manage to complete the 2 doses. Okay, and then out of that, only 9 that completed the 2 doses in 2 weeks, they actually got the infection after the 2 weeks of second dose. So out of those 9 people that got the infection, it was found that 8 of them were actually exposed to high risk, to situations where you did not comply to SOP, such as attending a wedding, attending some kind of majlis keramaian, right? So these people, they're actually involved in some kind of clusters, and that's how they got the infection. But we all know before we get the vaccine that this vaccine is not 100%. So this vaccine is, as we know, it is a Pfizer, 95% efficacy. So there's bound to have some people that might get the infection, but we know for sure that none of them had severe infection. Very few of them had symptoms, and their symptoms were very mild. And that is what we actually want. We do not want to overburden the healthcare system, where the hospital right now is full of COVID patient right now. Okay, as Sarawak is the champion for the past 1 week. Okay, champion not for the good reasons. Okay, we are champions, so we can just imagine the burden to our healthcare system right now. You know, the amount of staff involved in swabbing, tracing, quarantining, and treating, and then the ICU capacity is very high already. You know. So ventilators use also is high as well. So we do not want all that. We do not want hospitalization. We do not want to cripple our healthcare system. So this vaccination is actually very effective. So it reduces this burden to our healthcare system. So if you get an infection, you cannot hope for a miracle. Yeah, we have to be realistic. We cannot hope for a miracle, but we can do our best. So this is actually the best that we can do. We can vaccinate ourselves, and even if we get vaccinated, but we still get infection. So, but we know for sure that you will not get a severe infection, and that is very, very, very good already in terms of healthcare system. So that goes back to your question, whether we still need to comply to SOP or not. My answer would be that as long as we have not attained herd immunity, which means that the 80% of Malaysians are not vaccinated yet, we still need to wear masks and, social distancing, avoid crowded places, avoid attending like weddings, any kind of majlis, that you would need to, hang around for some time. And yeah, so those kind of things you want to avoid until, we know that we have achieved the herd immunity. So when you have achieved the herd immunity, even there is infection, it will not spread like a wildfire in our community. So
Yes.
so we still need to practice SOP as of now. Yeah.
Okay, all right, Doctor. Do you have any worldwide data to convince the viewers about the efficacy and effectiveness? Because we in medical line, we always been updated about the current situation. So maybe the netizen would like to know more about, so that they can be more confident about the effectiveness, like what you said, achieving herd immunity can control the rate of infection, so it will reduce the burden of the healthcare worker. Can you show us, Doctor?
Okay, so one nation that is one of the few nations that actually aggressively vaccinate their people is actually Israel. So Israel had already vaccinated majority of their population, and they have claimed that they have achieved herd immunity. So when you have achieved herd immunity, it means that you can you can safely say that the COVID infection will not spread like wildfire in your community anymore. So they can safely, go back to their life, their normal lives. You don't have to stay at home, have schools from home, PDPR, it's a lot of new norms that we need to, get used to during this COVID pandemic. But we try to, if you have herd immunity, we can aim to go back to our normal lives, which means like things like that are having a gathering with your family, you're able to hug and kiss your family members, these are things that we don't do it now because we're so scared of spreading the infection or transmitting to our family members or to our loved ones, and we do not want to be accountable for that. So that's what we aim to do lah, for herd immunity. So I really hope that people are more willing, actually they are willing already, but they are more willing to vaccinate themselves. I think there are a majority of the people, they are not against the vaccine, but they are just afraid to take it because they just want to wait and see. They want to wait and see if there's anything bad were to happen or not. If nothing bad were to happen, then yes, okay, sign me up for the vaccine, I'm all for the vaccine. So I mean, all this education is actually an effort to get the people to be more confident to get the vaccine, not to be afraid of this vaccine.
Doctor, as you said just now, complication occurred some lah, very very small numbers kan, but it is treatable. It is boleh diubati kan, all the complication that happen during so kalau complication dapat diubati, so nothing to worry lah. Betul tak doktor?
Betul,
I mean nothing to worry lah. I mean we can say safe lah. Because although complication side effect berlaku, tetapi masih dapat dirawat. Bukannya terus jika sesuatu berlaku, that's it lah, that's the end of your life. Thank you very much. Susah lah kan doktor, tapi it is treatable and can be managed accordingly. Betul doktor?
Yeah, betul. So that's why after you take the vaccine, we will tell people to monitor their symptoms, So when you monitor your symptoms, ada cara untuk monitor your symptom as well. So bila kita sudah bagi vaksin, usually we will counsel the patient on what are the possible side effects, and if anything were to happen, they need to monitor and inform their side effects. So you can do that on your MySejahtera app, where you can actually list down or notify your side effects on the MySejahtera app. So if you feel that you don't need to see the doctor, like let's say you have some body ache, some headache, but you're able to tolerate the headache and the body ache, so you tak perlu nak jumpa doktor, you just notify on the MySejahtera. Tapi kalau you rasa you perlu nak jumpa doktor, boleh je nak datang ke klinik kesihatan berdekatan untuk jumpa doktor untuk dapat rawatan. And also kalau dia ada, maksudnya kalau you ada kesan sampingan yang lebih serious, for example, which is very rare, we will always notify to the NPRA directly because surveillance is actually part of the whole program as well. When you implement an immunization program, once we already vaccinated the person, we need to monitor and survey whether there's anything, fishy or suspicious regarding the side effects. So this part is actually very important as well. So as part of surveillance, we need to, we can generate data. When we can generate data, then we can convince more people regarding our local data. Look here, there's like how many million people has been vaccinated already, and the number of side effects is this much, because it's local population, so local data is more convincing to our people as well. Yeah.
Doctor, I received a question. If the person is already got infection of COVID-19, how long does the posing period to get vaccine?
Okay, so from the latest guideline, our local guideline, we advise them to wait for 3 months. 3 months after their infection to be vaccinated. So they can be vaccinated even if you had COVID-19 infection, because as you know, majority of the people that get COVID-19 infection are asymptomatic, which means that they got no symptom. They just happen to be contacted by the pejabat, and then they found that they are actually a contact to a positive patient and they had tested. So that's how they find it, they're positive, So those kind of, majority of our patients are like that. So when you have not much of symptom, it also means that the immune response towards the virus is not so great. it means that your antibody production is not that much because your immune response was not so great to begin with. So that is why we still vaccinate people even after they had the COVID infection as well. Yeah.
Oh, okay. So maksudnya kepada para pendengar SIRI webinar ini, semua kita adalah eligible untuk mendapat vaksin. Mereka yang mempunyai masalah kesihatan, silalah berbincang dengan pakar ataupun doktor yang merawat. Dan buat masa ini, vaksin yang ada digunakan hanya untuk mereka yang berumur 18 tahun ke atas, doktor, betul?
Betul.
Alright.
Betul.
Okay, so ada juga pertanyaan daripada para pengunjung kita. Dia tanya kenapa bawah 18 tahun tak boleh dibagi vaksin, doktor?
Okay, sebab bawah 18 tahun tidak ada data lagi untuk menyokong kita memberi vaksin kepada remaja atau kanak-kanak lah bawah 18 tahun. So tapi setakat ini masih ada trials yang tengah dijalankan untuk mengaji vaksin ini selamat dan adakah dia efektif untuk remaja bawah 18 atau kanak-kanak bawah 18 tahun. Ya.
Maksudnya data establish sangat, so adalah lebih baik untuk kita menyelesaikan dulu fasa yang sekarang ini untuk melihat keberkesanan vaksin tersebut kepada masyarakat, kan, doktor? Okey, saya ada satu soalan ni, doktor, daripada Puan Fazrina Mustafa ni. Maybe dia nak tahu what is your views on pregnant and breastfeeding mothers on vaccination? Is it recommended?
Okay. Alright. So there are many women, especially childbearing age women, are either breastfeeding or pregnant. So for Pfizer, we are able to give pregnant ladies after being counseled. Maksudnya kita memberi counselling kepada wanita yang hamil itu mengenai risiko dan kebaikannya. Tapi kita tahu actually orang yang mengandung adalah salah satu orang yang dalam golongan risiko tinggi. So actually when pregnant women, when they get the COVID infection, they will get a more severe form of the COVID infection. And one of the most undesirable outcome is actually pregnancy loss. Maksudnya kematian dalam perut. That is what we do not want to happen. And usually this is one of the outcome undesirable, but it is very real. So they are very high risk. So these mothers, pregnant mothers, especially if they have other risk factors, such as if they are a frontliner as well, which means they always come into contact with patients, or patients that have got medical problems when they are pregnant, they are highly recommended to get the vaccine. Okay, they can get the vaccine and they are highly recommended to get the vaccine because as we know, yes, it is not, dia bukan dalam indikasi dia in the vaccine leaflet, but this is we know it's expert opinion by the whole of all of our ONG specialists in Malaysia. They have come to a consensus that it is safe and it is highly recommended in pregnant ladies with risk factors. So in those mothers that is just pregnant but with no risk factors, you can delay your vaccination sampai lepas bersalin. Okay, now we come to the breastfeeding mothers. So breastfeeding mothers is definitely safe to give the vaccine. Okay, so we can give the vaccine. You do not have to stop breastfeeding. You continue as normal, and so there's no issue in that as well. Yeah, so breastfeeding mothers can take. Pregnant mothers can take as well, but again you need to discuss back with your specialist or with your doctor that is in charge of you or managing you to come to a best consensus when you have already discussed all the risk and benefits of the taking this vaccine as well. Yeah.
All right. Okay, doctor. We have already going towards the end of the session. But a few questions pop up from our comment section here. All right. If let's say we've been listed to get vaccinated, and then we've been called to get vaccine. So do you have any tips before we go for vaccination? Do you have any tips to follow, like any certain food to take or not?
Okay, in terms of preparation, once you've already gotten the notification on your MySejahtera that you have a tarikh temu janji untuk vaksinasi, so usually you get the temu janji 2 minggu sebelum your tarikh vaksinasi itu. So during that time, you have a choice whether to accept it or not. Okay, so if the time is convenient for you and the date is convenient, you're able to get leave and whatnot, then you can accept it. So once you have accepted it already, then you just have to wait until your vaccination date. So a lot of people will develop a lot of they feel very nervous, very anxious. Which is very normal, okay, very normal. But make sure you have a good night's sleep before the vaccination. You do not want to be very tired on that day. Try to avoid, taking a lot of caffeine. Then try not to, take painkillers before your vaccination, because I can attest that the vaccination process is actually painless. It is a very, 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 very fine needle, and the amount injected is only 0.3 to 0.5 ml, which is very, very small. Okay, yeah. So it is very painless, so there's no need to take painkillers before your vaccine injection. Then there are some people that are very have phobia towards needles, which is, I think, a lot of people are. So probably my tip is not to look at the needle going into your arm when it's being vaccinated. Maybe you can distract yourself, by looking away or by doing something else, while it is very fast. It's not even a few seconds, it's very fast only. So during that very slight few seconds, you can just, think about something else, and by the time it's done already. So it is very fast and painless actually, but it's just that our minds get overworked and over anxious, that makes it so traumatizing for the people. So my other advice is that to wear comfortable clothing. You wouldn't want to wear something very tight, difficult to, because you need to vaccinate your arms, right? So you don't need to wear something so tight. It's very difficult for you to remove your clothing, or to sell up a bit, this kind of thing lah. Other thing is that to have if you're not fasting, you can have a meal before you go, because sometimes we will not know how long you have to wait at the center before your turn to be vaccinated, because sometimes people don't follow their appointment time. They just come when they feel like it. So there'll be a crowd during that time, and when there's a crowd, then you have to wait. When you have to wait, then you just have to wait. So we don't provide any food or drinks there. So I would advise, you can bring a bottle of water if you want to, if you feel thirsty. But those that are fasting, there's no issue. The injection itself will not batal your puasa. It will. So it's very, very safe lah. Otherwise, during the waiting period, that's nothing much that I can offer, except you can just have a phone to look at, so you can pass your 15 minutes or half an hour, which is quite fast. Then you can drive home yourself. So there's no need for somebody to drive you to the vaccination center, because you will not feel you would be fine after the vaccination. Yeah. So that's my advice for those that are getting vaccination.
All right.
Also, please do not forget to bring your IC. You need to bring your IC as well. Yeah, for verification.
All right. And then after we get vaccinated, because there's also in social media lah, they are saying that don't take other than paracetamol. Do you have any comment on that, doctor? Don't take painkillers other than Panadol and so forth?
Well, I do advise my patients to take Panadol only as well. Because when you take painkiller, what is a painkiller actually? A painkiller is the scientific word would be the non-steroidal anti-inflammatory drugs. So this is when painkillers, they are anti-inflammatory. So which means they suppress the inflammatory reaction in your body. When you get vaccine, whatever side effect you have is actually part of the inflammatory reaction of your body towards the vaccine. So when you take a painkiller that would suppress the inflammatory reaction, you're somewhat suppressing, the reaction that might be due to the vaccine production, antibody production. Sorry. So and also there is always the risk of getting some kind of drug reaction towards the vaccine and the painkiller itself. So we don't really recommend and say unless but if you have some pain that you need to see the doctor, I think it's best for you to consult the doctor first before you decide by yourself to just go and buy over the counter from the pharmacy, some painkillers as well, because it's best to just discuss with your doctor first. Yeah.
Alright, so sebelum kita mengakhiri sesi ini, khas untuk kaki tangan UiTM, bagi mendapatkan jam latihan untuk mengikuti webinar ini untuk dimasukkan ke dalam jam latihan, sila klik pautan kehadiran seperti yang ada di dalam section komen. Alright, Doktor. Last but not least, do you have any advice for us, especially UiTM staff and students and others who are following this webinar? Do you have any advice to convince those who are still 50-50 about register themselves as a voluntary receiver for this vaccine program? Do you have anything to advise to them?
Okay, well, those people that are still not decided to get vaccinated, I would advise you, if you want to have more information regarding the vaccine, at a personal level, you're highly recommended to go and see your doctor, your local doctor, to get more information. We are more than happy to accommodate your questions and answer all your questions and to help you to come to a better decision to vaccinate yourself or not. Okay. Yeah. And also my advice would be, please avoid all the majlis keramaian, that is the source of all the outbreaks and clusters in Sarawak, funerals, weddings, and now when it's a fasting month, I think it's best not to berbuka ramai-ramai, just try to keep SOP as much as possible, wash your hands all the time, wear masks all the time. And clusters were happening at workplaces is because, they think their own friends, they don't have the infection because we are friends, but the virus don't know that. The virus just infect everybody equally. So even with your own colleagues, try to, as much as possible, practice SOP as well. So that's just my last message to everybody.
Yeah. All right. Also, last message from me also as a moderator, I would like to thank you, Dr. Sarah, for giving us some very informative and very conclusive talk about and discussion about is it safe to get vaccinated or not. Thank you very much, Dr. Sarah, and we are hoping that we can continue this live series of webinar in the future, and then we can have some business doing in a normal way after we achieving the herd immunity in the community, inshallah. All right. Yes. So with this, I would like to end up this webinar series 3 conducted by Perpustakaan Tun Abdul Razak Campus Samarahan 2, and I would like to thank the organizer for inviting me as a moderator and Dr. Sarah as well as our guest speaker this morning.
Thank you.
So I will pass back to the admin for further announcement and further future program, inshallah. Okay, thank you very much, everybody. See you soon.
Thank you.
Bye. Happy
Bye.
Ramadan.